So it's data driven. We look at the analytics quite a bit. Our website has great analytics as far as we know where people are finding us, where they're searching us out. We capture a lot of the, zip codes and things where patients are traveling to see us. And then we have relationships, that are nationwide. We work with Amazon, we work with Sedgwick, we work with a lot of, large employers. Again, before we started recording, we talked about some of the self-insured employer incentives and projects that we're working on right now. And we know there's a need based on them telling us there's a need.
Welcome to the Expert in You podcast, the show where we have real conversations with established founders, firm owners, and B2B experts selling their expertise as services. We talk about what's happening now inside experienced businesses where positioning, influence, and growth directly affect opportunities and contracts. I'm Ann Carden. Let's get into it. Hey everyone, welcome back to another episode of Expert in You podcast. I'm your host, Ann Carden, and today my guest is Eric Lowe. He's the CEO and co-founder of Aptiva Health, and we're going to dive into what that is. He helps scale multi-site healthcare platforms. So Eric, welcome to the show.
Yeah, Ann, thanks for having me.
Yeah, I'm so excited for you to share what you are out there doing. You're expanding and so many great things are happening for you. Why don't you just give us a quick rundown of exactly what your company is and what you offer?
Sure. Yeah, I'm actually in Indianapolis right now. We have a new site that's going to be opening here next week. So excited about that.
Nice.
Aptiva Health's a independent multi-specialty group. So independent in that we're not hospital owned or affiliated. We're completely independent. And we're multi-specialty. So we have a lot of different healthcare services and specialties all under one roof. So everything from what we call immediate injury care. Some people call it urgent ortho. We like the immediate injury care. It's the idea that you can come in and be seen for a laceration or broken bone or orthopedic injury and not have to worry that somebody's sitting next to you with the flu. To orthopedic surgery, total joint replacement, orthopedic spine surgery, pain management, physical therapy, physical medicine and rehabilitation, neuropsychology, psychology, psychiatry, advanced imaging, just a wide gamut of different specialties. And the idea is really about making it more convenient and accessible for patients and affordability. So those are things that we can talk about more. But currently we're at 13 locations throughout Kentucky. We're in Louisville, Lexington, Northern Kentucky, Elizabethtown, and Mount Washington. And then we have our 14th site opening in Indianapolis next Wednesday, May 20th.
And so I'm just trying to understand the structure. So inside that particular site, that particular location, there are multiple people that you can see. Is that correct?
Correct. Yeah. So we have what we call a hub and spoke model. So
Okay.
the hub is, really one large facility that has imaging and procedure suite and clinics and orthopedics and PT and all those good things. And then we have satellites, and the satellite can be an immediate injury care center, which is a clinic and physical therapy and imaging. And then we have just standalone physical therapy centers. But the group as a whole has all those different specialties. And that's really how we got started, was having one large location and rotating specialists throughout that location. So the patient could come to the same site every time or go to one site and have multiple services on the same day. So it's all about convenience and accessibility.
Okay. That makes sense. How did you get into this?
Yeah, so happenstance, luck, good fortune, blessing, whatever you want to call it. My best friend in college that I played football with, his uncle was a physician, and when I was in law school, he asked me to come over and help him move a couch. It happened to be the heaviest couch on earth, but we struck up a good conversation, and he was going from being a general surgeon back to his first board in PNMR medicine, so physical medicine and rehab, and starting an outpatient clinic, and gave me an opportunity, and that's kind of how I got my start. I started with him and started a revenue cycle management company, which does the medical billing and coding and follow-up for medical claims. Started doing some practice management, and it just evolved into my experience seeing, why can't this be easier and faster and more affordable for patients? And that's really where the idea stemmed. And then I met Dr. Hune, who's my business partner, an ER physician, and nobody has really a better perspective on how broken the healthcare system is than an ER physician, because they're seeing people come in there for toothaches and seeing people come in there 2-3 times because they can't get a follow-up visit with their primary care for 2 months, or can't get in to see somebody, or somebody doesn't take their insurance. So we had a common problem to solve, and that's how we partnered and started Aptiva Health.
So when you started it, so you had the general physician, and then you brought somebody else in under that. So it would be very much like starting some sort of a practice, and then you bring other people in under you, but you're all under one roof, and you all do. How does the affordability part work? Like, if you think about insurance and the expense, and first of all, I love this. We already know the healthcare system is very broken. And so I love that you are solving this problem, but how does it all work? Would people, it's out of pocket, I'm assuming, more so than being able to turn it into your insurance company, or how does that all work?
Yeah, it's a great question. Healthcare system is broken, and part of why it's broken is it's a veiled system where nothing's transparent. We really don't understand why things cost what they cost, and
like a Band-Aid, $10,000.
Exactly.
Why does a Band-Aid cost $10,000?
Right, exactly. And part of that is the game between, you have hospital systems, you have insurance companies, and you have physicians, and then you have the patient. And really what we try to do is turn back the clock, in that we want the physician to have a direct relationship and interaction with the patient. And that's what we want to focus on. So when I started by saying we're independent, why that matters is when you're a hospital-based system, you get reimbursed at hospital-based or facility-based rates. We are independent, so we get reimbursed on a provider fee schedule. So when you go see your primary care physician, if they're owned by a hospital system, you're not just paying to see the physician, you're paying for that system. So it can cost 300 to 500% more than just going to see an independent provider. So where we're independent, even if you have health insurance, it's more affordable for you, because there is no system that you have to pay in addition to that provider professional fee. So that's the first thing. The second is, where I have a background in revenue cycle management, I understand what things cost and how much we get paid. And what we've wanted to do from the very beginning is to make those figures transparent and available to patients. So in the last 3 or 4 years, you've heard a lot about healthcare transparency. And there was a federal mandate that hospitals had to publish their pricing. Well, they kind of did that. It's buried 300 pages deep in some website that nobody can really interpret or understand. We do the opposite. We have a page on our website called Affordable Options, and every single thing that we provide has a price, and you can click a button and you can buy it right there, and you get an alphanumeric code. And when you walk in, you show us that code, we click redeem, we get paid, you get the service. And there are no more costs than that. So those are the two primary ways where we're really trying to fight the affordability.
So is it still turned into insurance? So like if I come in and I want to use it, does it still go to my insurance company?
So good question. It's either or. So if you have health insurance and you want to use health insurance and we bill health insurance, we have a contract with the health insurance company. We have to charge you what the health insurance company tells us to charge you. The way the affordable options comes in is if you have a high deductible plan, if you have an HSA or FSA, you can use those dollars towards that, or if it's a non-covered service. So one of the things that we do a lot, especially, is with MRI imaging. From January through the end of March, we run a special where it's $299 for an MRI. Well, if you haven't done 6 to 8 weeks of physical therapy, if you haven't failed an injection, most of the time insurance companies are going to deny, saying you can't get that MRI yet. You have to do these 7 things before. And what the patient needs to understand is each time you go to physical therapy, let's say, you're going to have a $50 to $100 deductible for most commercial insurance companies. You do that 12 times, we can all do the easy math. Versus if you pay for the MRI out of pocket, even though you can't submit it to your insurance for $299, you get the answer you need. If we find something objectively that's torn or needs operative intervention, we can then have your insurance cover the operation. So it's just, we try to get to the answer faster.
I love that. Wow.
It's about getting people back to life, not stuck in a system.
It's not really a concierge system, but it's similar in a way. It sounds like where it's you're patient forward.
Right. Yeah. It's really a hybrid model where we accept health insurance. We can bill Medicare, Medicaid, all the different plans. And then we can also do cash pay. And we have a wellness side of our practice where it is concierge that people can pay a monthly fee. And then we really take that towards a lot of employers. And those are the small to medium sized employers that maybe you have 5 employees and you can't afford health insurance yet. But you could afford, $75 a month for your employees to go and see a primary care physician anytime they want each month. That's what we tried. Again, we're trying to serve as many patients as we can, as affordably as we can.
What a great idea and what a great system. I absolutely love this. I'm sure that as you do this and you continue to expand, other people will want to follow suit. We definitely need some shifts and some changes in our healthcare system. And I've worked with a lot of surgeons and physicians and chiropractors, and they all are trying to go, or most of them, concierge, or they're trying to go to is more of a cash model to get out of the insurance system because it's so flawed and it's such a mess. And it just dictates what kind of care you're going to get. They are the drivers, right? The insurance companies are the drivers. So it sounds like you have found a really great solution. You said you have 14 locations now?
Yeah. So as of next Wednesday, when Indianapolis opens, yes.
That's amazing. So how do you get started in a particular location to get enough people on board? How does that happen? So now I want to talk more about your business model and how you're growing this and how you're doing things. So how does that happen?
Yeah, so it's data driven. We look at the analytics quite a bit. Our website has great analytics as far as we know where people are finding us, where they're searching us out. We capture a lot of the zip codes and things where patients are traveling to see us, and then we have relationships that are nationwide. We work with Amazon, we work with Sedgwick, we work with a lot of large employers. Again, before we started recording, we talked about some of the self-insured employer incentives and projects that we're working on right now, and we know there's a need based on them telling us there's a need. If they have, Amazon has quite a few warehouses in Northern Kentucky, Cincinnati region, so that's one of the reasons we opened in Northern Kentucky. Indianapolis is very similar. It's a hospital-dominated market. You have a lot of large hospitals and a lot of large systems, so there's a lot of cost. If we're able to come in the market with really good physicians and surgeons and offer the same or similar or better services at a lower price, and we're able to do it faster, then we have some large, employers that want us to do that.
It's so interesting. It's kind of like a one-stop shop in a way. That's
right.
It's not a great way to say it, but somebody was just telling me the other day that I think she was saying Hong Kong, that they have a thing where you can pay, a few $1,000s, and you can go in and literally in one day they'll do all your scans, all your images, all your everything, and they'll tell you everything that you need to know for your health. And I just thought, what a cool idea. That would, we don't have anything like that, right? So this sounds like kind of a cool thing along the same line.
And what you're just talking about, we actually offer that. It's called the Executive Physical Protocol. So
really?
we have,
okay, this is cool.
So we have an Executive Physical Protocol that we developed, meshed between Mayo, Cleveland Clinic, Vanderbilt, took some of the best ideas, ran it through our medical team, and developed a protocol that it provides MRI of your brain, an MRA, so it checks your main arteries and everything, a calcium score CT, an abdomen and pelvis CT with and without contrast, a full comprehensive lab panel, an EKG, and physical exam, and it's $3,500. We actually found a brain aneurysm in a gentleman right before Christmas at 60 and took him straight from the imaging center to emergency surgery, saved his life. So it's really preemptive. You can go in and, there's some different research about, the calcium score CT. It's phenomenal for the calcified plaques. Some of the soft plaques, it's not going to measure as well. But with the blood panel, with the EKG, with all the different things, we think it's the most comprehensive exam that you can get, especially at $3,500.
Well, there is, Lifeline is out there. That is one of the companies out there that does, the artery checks and things like that. And but they don't do really like all this the same kind of, it doesn't sound like the same kind of scans and things like that. They're doing nothing with your head or your brain. So is this like a full body scan? Do they check for things like cancer? Do they, so they see all those, are able to see all those things. That's really cool. I had no idea, Eric, that was even offered anywhere. So I would think there would be just huge value in people getting that done. So let's talk about, before, again, we talk more about your business and the side of that, what are the 14 locations you have?
Sure. So we have 6 plus our corporate office in Louisville. We have 3 in Lexington. We have.
And you're from Kentucky, right?
I am.
Yes.
I live in Louisville, Kentucky. And then we have Elizabethtown, Mount Washington, Northern Kentucky. That's the Cincinnati metro. And then the newest one's Indianapolis. And then we also own a building in Jeffersonville, Indiana, where we're going to convert to our own surgery center. So having our own ASC will be huge as far as what we're able to offer. We think, and the research that we've done shows, the data supports that reverse tourism could be a thing, where if you're in Canada and you're waiting 1 to 2 years for an elective orthopedic surgery, if we're able to do, let's say, a meniscus repair for $2,500 by the LA Lakers former surgeon, you would come to Louisville, Kentucky for that surgery. So that's our goal, is having our own surgery center and being able to control that entire cost.
That's really cool. I know with Canada, I know a lot. I've had a lot of clients in Canada, and I know a lot of people there, and their healthcare system is worse than ours. In fact, for many years, they were coming here to get healthcare. I don't know that that's happening much anymore, because I think we're just as bad as they are. It has just progressively gotten worse since, I don't know, it seems like about 2008 or 2009 was when the whole shift happened, I think.
Yeah, it's post Affordable Care Act. I mean, when you changed how much, when you changed how much hospitals were being reimbursed, and they could make 3x of what a primary care physician could, the hospital systems looked at their fee schedule and they said, well, we know we're going to increase what we're getting paid. We'll acquire all of these practices. Now we control the patient referrals, and now patients get stuck in the hospital system when, and I am not the guy that it is bashing hospitals. Please don't take it that way. Hospitals do a phenomenal job at a lot of things. But if it's outpatient care you need, there's no reason you need to be in a hospital for outpatient care. And the reason that it's gotten so expensive and so difficult and everything takes so long is because when the systems own the primary care physician offices, they're mandated to refer within their system. So the patient, you just get stuck, and a lot of people just don't know there are other options. And how difficult is it to pick up the phone and call 5 different facilities to try to get an MRI versus the hospital that my primary care physician told me to go here. I know him. I'll just go there. And then you're stuck with a $1,500 bill versus a $400 bill.
Oh, and it's so jacked up in so many ways too. What's in network, what's out of network. And then you can have a surgery, and then all of a sudden you've had, the anesthesiologist was out of network, and now you're paying out of network. I mean, it's just so messed up in so many ways and so many levels.
Agreed.
Yes. And the other side of this too is, working with, surgeons and people in the medical profession, I've just learned how they are just so burned out. The physicians are so burned out. So many people are leaving their practices because they are mandated to herd people through like cattle. Like you get 10 minutes with a doctor, 10 minutes. And if you go in for more than one thing, they say, well, that's not what you came in for. And so you have to make another appointment for that. And you've already waited 2 weeks. I mean, it's the craziest thing. When I just think back to what happened to the doctors where you went and you said, these are my issues, and they took care of you, and all of that is just so gone. It's just so gone in our country. And I love that you're finding the solution. So you keep saying we. How many are on your team? Do you have co-partners? Like, what's the structure of your business? What's the infrastructure?
Yeah, so Dr. Hune is my partner. It's a 50-50 partnership. We have 200 employees, and that includes physicians, providers. We probably have another 10 to 15 independent contractors, so between 2 and 220 people that work for the organization. But yeah, it's just Dr. Hune and I. I mean, we're right now looking for some different avenues for growth, and a big push of ours is how do we make stock options and equity available to the providers that are helping us scale, and that's our next phase of growth.
Very cool. How do you get paid? So you get all these doctors and everything under you. How does your business make the revenue from this model?
Yeah, so they're all employed physicians with us. So the system,
okay.
yeah. So Aptiva Health is the one that's actually billing for all the services that are rendered. The unique structure that we have is that, to my knowledge, well, especially in our area, we're the only independent group that actually provides an employed model, in that the physician has a guaranteed salary plus bonus compensation, incentives, all the other things, but it's not a eat what you kill model. A lot of orthopedic surgery practices, you only earn what you produce. So it's a big drive. What we are able to offer, especially the providers, is just a quality of life that they can't get anywhere else. We don't mandate call. You're not working nights, weekends, holidays. We have a lot of optionality as far as how we do documentation. You will never see a surgeon or a physician at our office stand behind a laptop and type into the computer. We don't do that. The things that drive me crazy about healthcare are the things that I implement in our practice. We purposely don't have sliding glass windows at a receptionist, because I can't stand when I go to a medical receptionist and I know they see me, but they refuse to open the door. So we don't have that. Same with
love it. Oh my
yeah.
gosh.
Same with the physicians. That we don't want the person that is supposed to be connecting with the patient standing behind a computer screen. So we use electronic dictation. We have Air AI that can ambient AI that can transcribe real time. A lot of technology that we've developed to be able to make our physicians more efficient and maximize the time they can spend with patients. That's our focus.
So can the physicians make as much money working for an independent company like this as they can working for like a big hospital organization, or where they get reimbursed for insurance? Like what's that all look like?
Yes, it's very comparable. So we have taken contracts from hospitals and matched those contracts. The difference is, and where the upside, one, is the quality of life, what we talked about, and two, it's the ancillary investment opportunities. So the surgery center is a big one. If you're employed by a hospital, you don't have any of those investment opportunities available to you. You work strictly on a salary and RVU basis, and RVUs, to me, it's a little convoluted. It doesn't make a whole lot of sense. So by investing in the surgery center that we're going to have, the physicians will be able to have an equity stake and be able to have a return on their investment.
Very cool. This is such a cool model, Eric. I love what you're doing. We didn't get into all this in the pre-call, actually. I mean, we just sort of talked about the direction of the show, and this is so fascinating, and I love it. When are you coming to Missouri?
So there's some opportunities for us outside of St. Louis. It's on our short list over the next probably.
That's where I am.
That's St. Louis. Yeah,
that's where I am. I'm outside of St. Louis. So, and we have such a need. My husband just had to go through some hip surgery, and that was a 9-month process to get all that done. And yeah. So.
Yeah, that's where we can tell. I can tell you patient testimonial after testimonial, and you can go, on Google or our website and see some of them. But we had, for instance, an ex NFL football player that called in, was able to be seen the same day, was able to get an epidural injection the next day, and by Friday, this was a Wednesday. By Friday, he was 100% pain relief. So all the things that take weeks and months everywhere else, I mean, we just try to look at what the hospitals are doing and do the opposite. That's the model.
You found a gap in the market, and you're filling it, and I just love it. Your biggest problem is going to be everybody's like me. When are you coming to our state? When are you coming to our area? Right? I would think that would be your biggest growth problem. Is how do you make all of this grow as fast as you probably want it to grow?
Yeah, that's been something that, has been top of mind for the last probably 2 years. Over the last 3 years, we've had our most explosive growth. And over the last 2 years, it's how do you scale in a way where you don't dilute what you're providing. We want the work
Right.
product to stay the same regardless of where we're at. The
Yeah.
biggest part of that are our people. The way we treat our people, the way we teach our people, all those things are vital to how we operate. If you walk in any clinic that is Aptiva Health, you will see people smiling, engaged, knowing patients on a first name basis. We want it to be a different experience. And that's why, top 5 referral sources are previous patient and friends and family. Because once you come to us, and it might be you fell at home, that you got hurt at work, there's all kinds of different ways you can come to us. Those patients turn into forever patients. And then they
I'm
go
sure
out.
they do.
Yeah, and they evangelize what we do to everybody
Yes.
else and say, hey, you have to go here. Don't go to the big system where it takes you forever to do everything and it costs you an arm and a leg. And then, like we were talking about a little bit before, the big push for me in 2026 has been, how do I go directly to these large self-insured employers and show them we can get people in faster, we can get them better faster, and we can do it cheaper than anybody else. And that's where we've really been doing a lot of the direct contracts. We're doing bundled surgery agreements now. We had a couple patients last week that came to us from Alabama. And we're a tier 1 provider with these systems, and Carum Health, a big organization, designated us as a center of excellence. So when a patient comes to us, there's no copay, there's no coinsurance, there's no deductible. As long as they're affiliated with one of these self-insured plans, they can have surgery, they can follow up with us, and they can go home, and it costs them nothing, because we're saving the self-insured employers so much time and money, and they know our outcomes are going to be quality, that they'll pay the entire bundle and the patient has to pay nothing. To us, that is the biggest thing we can do in healthcare, is if we can get people in without having the burden of it being exorbitantly expensive, they will get the care they need when they need it.
Amazing. So let's take a small business, for example. They have 10 employees. What can you offer a small business like that?
Yeah, so a 10-employee business would be a wellness program. It would be an introductory where they can pay a monthly fee for each of their employee to have direct access. So they can walk in, they have urgent care, primary care, they can see us. We have a contract where we can include generic pharmacy dispensing. So some of the most common antibiotics, flu shots, different swabs to check for flu, for strep, and for all those things. And so it provides a benefit to the employee that although they might not be able to afford paying a health insurance premium for each one of them, if it's $100 or less a month per employee, it's a lot more affordable, and the employees have direct access. And we do telehealth that way, and all kinds of stuff. And then it scales from there, the more employees, so that we're really a la carte as far as what we can offer people.
That's so cool. One of the biggest concerns right now is that a lot of physicians are leaving, and a lot of people don't want to become physicians. Are you finding it hard really to find the good help that you need, or are you finding that people are beating down the doors because they want to get in on this?
The latter. We have a line of really, really talented physicians and surgeons that are wanting to come over, because some of the physicians, if you go to our website, aptivahealth.com, you can see our team. I mean, we have 2 neuropsychologists that are experts in concussion care and treatment from UPMC. There's only 39 neuropsychologists that have ever completed that fellowship. 2 work for us. The former team physician for the Lakers, the spine surgeon that did the first artificial disc replacement in the state of Kentucky. All these physicians are, really well known, and when you have that, it creates that snowball effect where everybody's like, "Well, what's going on over there? I've got to, be part of that."
So, Eric, you're running just this really successful company, and you're doing such great things out there. What keeps you up at night with this?
That's
because
a really
things are
good question.
going well, but there's underlying things, right, that are probably stressors. What is that for you?
The biggest stressors are growing smart, and you can have all the numbers, and you can look at all the data, and you can understand the analytics, but how will the community respond and adopt something that's new or different? And that's the biggest uphill, is education. We're working right now on what we're going to call Aptiva Health University. And it's really a learning hub to be able to talk about and explain all the things that we're talking about. Transparency, affordability, why it matters where you go, and site of service, even if you have insurance. insurance? What's the difference between hospital-based services and independent services? All those things, we just really have a lack of what we call healthcare literacy because it's complicated, it's convoluted, it's purposely confusing. It is.
It is. They make it that way. Yes.
Right. And so there's just a big curve as far as how do we get the information out there. And honestly, I think AI is going to really help that. I mean, the answer engine optimization that we're able to do with Q&A on our website, and that's one of the big things we're working on right now. ChatGPT and Claude and all the other models, you're asking questions, and the difference between a Google search and what you're doing with ChatGPT is typically a Google search is 4 to 6, maybe 8 words, and you're looking at the first results that come. ChatGPT, it's layered questions, so you're asking a question and then diving deeper and then diving deeper and then diving deeper. So by doing that, if we have the most relevant content with the most information, people are going to be able to educate themselves, and it's so fast that where you can do dictation on your phone that I think just the availability of the information over the next year or two, healthcare specifically, is going to be what changes things. And that's what keeps me up, is how do we get the information out there? How do we educate people?
You're doing it right now. I mean, this is,
you're right.
Is this why you're on the podcast?
100%. That's why I started doing this. I want to get the information out there to as many people. Ultimately, you are the decision maker. You are the one that controls your healthcare. We want you to be proactive. We want you to have the information, and we want you to make the best decision for you.
You have to be your own advocate for your health.
You have to.
You absolutely have to. So where do you see this company going, Eric? First of all, it's going to be innovators like you and what you're doing that is going to change the healthcare system, and hopefully faster. Because they're going to have to make changes if people are going other ways and doing other forms of healthcare. So I think it's disruptors in the industry that are going to make a difference. So I'm so behind you on this, and I'm so excited that you're doing this. But where do you see this company going for you? What's in your future?
Yeah, broad. My goal is to make it the largest outpatient health system in the United States. That's our goal. So it's, how do you get there? How do you scale to that point? It's, piece by piece, solve one problem at a time. So, we're focused on the Midwest and Southeast right now, and that's, over the next 3 to 5 years, but there's no reason that we can't take our platform nationwide. With our ability to contract with self-insured employers to be able to reach people where they are and give them the services they need. We know musculoskeletal injury and orthopedics in 2025 became the second highest cost to self-insured employers over cancer. Most people would not believe that. That just shows you how expensive it's gotten because of all these major systems. If we're able to do it faster, better, and with the best outcomes, that's where the Amazon that's paying the bill, if they have these tens of thousands, hundreds of thousands of sites, they need this solution because we have the common interest in, if the patient is healthy, the employee can be at work, can have a good quality of life, can perform a service or produce a good. If they're not healthy, they can't. So that's where we have that commonality and interest of, how do we get people in fast? How do we diagnose them precisely and get them back to life as quickly as possible? That's the model.
How long did it take you to get the first kind of facility up and profitable? What did that look like for you as you were starting out?
So it's a very unique story. It's different than most of healthcare. I could say I've never heard of anybody else doing it. But so how we got started was in Lexington, Kentucky. There was an independent orthopedic group, a spine surgeon and a sports orthopedic surgeon that had one location. They had a secondary location that they were only using about 50% of capacity. So I approached them with Dr. Yoon and said, listen, Tom, he goes by Tom. Tom is an ER physician. What we would like to do is be able to have him evaluate, triage, and refer within your system to ortho, spine, imaging, PT, injections, general orthopedic, sports medicine, all those different things. But we're gonna pay you guaranteed, but it's going to be a net 90 terms. And they said, okay, well, we have unused space. It costs us nothing. You're going to pay us rent, and you're going to guarantee payment? And I said, yes. The only catch is it's 90 days. Because I knew, based on my experience with revenue cycle management, if by day 90, we would have collected enough to at least break even. And after that, the snowball begins to accumulate, and then it compounds. So that's literally how we got started. And within 3 months, we were break even. At 6 months, we were profitable.
That's amazing.
Yeah, at 6 months, we were profitable. And then we opened a second clinic location within 6 months and continued that for the first four, that was 2014 until 2018, when we started hiring full-time employed physicians. So during that time, we were taking physicians that had an extra day. A lot of surgeons work Monday through Thursday and take Friday off. So we created what I call a virtual practice model. We did all the marketing, we had all the staffing, we did all the billing. They would just show up and treat patients. And our goal was to do everything else except patient care.
That's like a dream for them, right?
It is.
They don't want to do all the other stuff. They want to just do what they love to do and what they went to school to do. Yeah,
exactly. And that was our pitch. And what's funny is, although we have, the full-time employed model today, we're not taking that off the table. As we're going to Indianapolis, that's not the same of how we're getting started. But when we go to new places, there are a lot of physicians that have interest. So we can start small and scale from there. And that's been, how we've done business from the very beginning. We've never taken a loan. We took $25,000 of proceeds from from another company to start Aptiva Health. Everything we've done has been cash. We paid for 3 imaging centers cash, all of our equipment, everything. But we've reinvested. Right. We've taken, first 2 years, Tom and I didn't pay ourselves. First 6 years, we didn't normalize a salary. You have to have those short-term sacrifices for long-term gain.
Absolutely. 100%. I bootstrapped a lot of businesses that I sold. And so completely understand where you're coming from. And you're reinvesting back into that with the intention that it's going to grow and multiply and it's all going to come back to you. And at some point, Eric, you'll exit and you'll figure out how you can sell or whatever. I mean, we all exit a business at some point. But I love this, and I so smart. And one of my, I think, kind of a pet peeve of mine is that everybody now thinks they need to get investors to start a business. That drives me crazy, because I didn't do that with any of my businesses. I started them with just hard work and doing the thing and then growing it from there. And I bootstrapped. And now looking back, there were probably some things I would have done differently, for sure, knowing what I know, but I didn't go after investors. And I just came across somebody on LinkedIn that reached out to me and said, I'm looking for startup investors. And I'm like, what happened to people just starting businesses and doing the hard work? Why are they out there looking for investors? It drives me a bit crazy, I'm just going to say. So kudos to you. I'm so excited that you said that. I love that.
Thank you.
So smart. The other thing that I just want to hit on is the innovation that you used. This is something that a lot of people don't think about when they're starting a business. Using your resources, being smart, being innovative. People, I remember during the 2008 recession, I made the decision. Everybody else was shutting down around my 2 businesses that I had. And I made the decision I was going to expand and open 2 more in a completely new location. And everybody was shutting down, and people thought I was just nuts. And it was scary. I'm not going to lie. It was very scary to do that. But I was able to take advantage at that time because people were not renting spaces. So I got better rent. I got advertising cost lower. I was able to get great help because people were laying people off and firing people because their businesses were struggling. And I was picking up great help. It was such a game changer. I was able to take advantage of the market because the way I used my resources and the way I was thinking. And that's really what we're talking about here, is the mindset and the thinking around how to be resourceful and how to make things happen and make things work. Not looking for the handout, but how can you get really innovative? And I've done that with all my businesses. And so what you're saying just resonates with me so much. It's exciting to hear that. It's exciting to talk to an entrepreneur that's actually done that.
I appreciate that. Yeah, it's they say in every crisis there's opportunity.
There
So
is.
it's just those that have the faith and are willing to take the risk. I think the scenario that you're talking about, I think we're going to be seeing that next year and the year after in healthcare. There are major Medicare and Medicaid cuts coming, and there are a lot of systems that I don't know how they're going to make it. And there are a lot of good physicians and a lot of good people that they're not going to be able to operate the same way. And
Mm-hmm.
that means cuts are going to come, and there are going to be really good people out there. And our goal is to grow and get those good people because we have not been dependent on a lot of those same payers that the hospital systems have been dependent on. And we know what our operational costs are to the dime versus 1% could be $10 million to a hospital system. Well, if you're off by 0.01% of that, and it compounds month over month, it adds up really quickly and the hospitals
Right.
get upside down. And then what are we going to do?
Not only that, I have to say their billing is just atrocious. It's absolutely atrocious. When you get any kind of billing from the hospital for anything that you've had done, I told my husband when he went through this hip surgery, he said, "Here's the bill from the hospital." I said, "Just wait it out. Just wait it, because until the insurance does their thing and until everybody else does their thing, it literally the bill changes every week. It's just insane." And what they're hoping is that people will just pay it and think that that's what they owe, but it never turns out to be that. And so the whole thing is just so whacked. It's just
Yeah, I mean that's the
so
whole reason
crazy.
we're doing the bundled surgery initiative with the direct self-insured employers, because if you go to a hospital system versus an ASC, it just costs them 300% more, and now
Mhm.
they have to worry about, okay, well, was the anesthesiologist in network? Did they use
Right.
neuromonitoring? Was it 23 hours or was it longer? What kind of
Mhm.
bracing did they give? All those, so there could be 8 different bills from 8 different vendors for one surgery. Well,
Exactly.
with us, they pay one. And then we pay everybody because we've negotiated with everybody else. So for them, it's
Yeah.
just that aspect of they know what it costs up front. There's
Mhm.
no guessing. It's simple, and everybody gets what they want. That shouldn't be innovative.
Right.
You can't
Right.
go into a sandwich shop and then somebody sends you a bill 30 days later for the pickles versus the tomato versus nobody does
Exactly. That's a
business
great
like
way
that.
to say it.
Yeah,
Right.
it's
Right.
just
So, Eric, you guys, did you say you do your own billing or do you have
we do.
administrators?
Yeah,
Wow.
we do. Yeah, so
Wow.
that's the background we have. So I did exit out of the revenue cycle management company because Aptiva was, growing at the pace it was
Mhm.
back in 22. But all the billers, the coders, the AR people, the pre-auth people, everybody associated with that stayed with us. And now we're deploying a lot of technology, some of the, AI, what it can do with some of these agents and the process workflows that revenue cycle management has and all these payer guidelines. Being able to employ those models and use your people instead of doing the monotonous, repetitive tasks day in and day out, hours a day, and having these AI agents that can do that and they oversee and run prompts and commands. That's the future because all the health insurance companies have already deployed AI and they're
Mhm.
doing blanket denials and they're making things more difficult. And there's already, large class action lawsuits against United Healthcare and some of the other carriers for that type of action. But if you're not doing the same on the provider side, you're going to get left behind.
Mhm. Wow. This has been so fascinating. I know you're going to crush it. You really have something here. And I think it's just amazing. I am so happy to have you on the show and share all of this. What would you like to leave people with?
Great question. You are in control of your healthcare. You get to make the decision. Ask what it costs. Ask if you can get the service somewhere else. Ask if they're a hospital-owned facility, if this is the only choice that you have, or if you have an alternate choice.
Mm.
Call and ask the question. Like you said, Ann, you are your only advocate in healthcare. Ask the questions. No question is a dumb question, especially if it saves you time, money, and your health. It's worth the investment. It's worth asking the question. Don't be afraid to ask the question.
Do you help people with that? So, like, if they contact you and they say, "Oh, I have this kind of insurance," or "This is the area I'm in," or whatever, do you kind of help them work through that process? Do you have someone that does that, or?
We do. We
Okay.
have patient advocates, and we have different people in our revenue cycle management department that are happy to have the conversations, especially with billing. We are upfront, we're transparent, and again, what we tell everybody is, here are your options, and here's our affordable options. So if this is your scenario, and that's one of the things that our providers have been trained really, really well at, and they do a great job, is they talk to patients not just about their care, but the cost of the care. That, hey, here are your options, here's where you can go. We could do this at the hospital, we could do it at the surgery center, or we could do it at the office. Same with all of our interventional pain management injections. All of those are done in our office, because if you come to our office, you only have to pay that physician fee. If you go to the surgery center, you have to pay the surgery center and the physician fee and any anesthesia. If you go to the hospital, now you pay 5 people. So all those things compound, and we're doing it. Tom and I have a very simple mantra. We're not altruistic, but it's, if you do the right thing, life's pretty easy. So just do the right thing.
So good. Well, thank you so much for being here. We're going to put all of your information in the show notes so people can reach out. Eric's on LinkedIn. You can find him there if you want to connect and just have a conversation with him. Get him on your shows. If you have a podcast out there, we want to get this out for people. And I'll be excited to promote this as well, Eric, because I really do love what you're doing. So thank you so much for being my guest.
Absolutely. Thank you for having me. And as we approach St. Louis, I'll definitely let you know.
Yes, 100%. All right, everyone. Thank you again for being here for another episode. Make sure you share this episode and subscribe to the show. And look, if you are an agency, a firm owner, or an expert who sells your expertise as your service, and you want to elevate in your market, you want to go into higher caliber clients, bigger opportunities, and you want to start generating the higher revenue that you deserve for all of your years of experience, reach out to me and let's have a conversation around your elevation, because you deserve more. Let's move you to top of market. You can book a call with me at acarden.com. It's what I do. All right. Have an amazing day. God bless you. Bye-bye.
The content of this podcast is for informational and educational purposes only. Although I share strategies, ideas, and success stories based on real experiences, results are never guaranteed. Every business is unique, and outcomes depend on individual effort, market conditions, and many other factors. By listening, you agree that I and my guests are not responsible for your results or actions based on the content shared.
Thank you for tuning in today. If you're as excited as I am about scaling up your influence, business, and bank account, then I have just the thing for you. But first, make sure you subscribe to the show. Second, make sure you share it with someone you care about, because sharing is caring. And third, head on over to join me in my next free virtual exclusive workshop, where we'll explore proven strategies to boost your business and maximize your potential. Look, it doesn't matter if you're just starting out or if you're looking to take your business to the next level, my workshops are designed for you. So head on over to expertinyouworkshop.com to reserve your spot and get ready to transform your expertise into extraordinary success. I'm looking forward to seeing you there and helping you achieve incredible growth. Until next time, make sure you're always seeking the expert in you, and God bless. Have an amazing day.